Hi guys, good evening. I'm sorry we had a little bit of a tech issue tonight, but anyway, it does happen, especially with the audio. That's usually a problem. But anyway, everything is okay now. Somebody was helping me a little bit, so how to fix the issue or the problem, guys. But anyway, welcome to our Facebook Live on Nursing Prioritization Delegation again tonight. We do this every Thursday. That would be from 7 to 8 p.m. So for tonight, we have prepared you several questions, and I would like you to guess what is our topic for tonight, everyone. Our topic for tonight is going to be about arterial blood gas. So it's going to be exciting how to find out, or to find out how's your knowledge or background content in terms of arterial blood gas or acid-base balance. Just really a few questions for that. Of course, we will end the session with delegation questions as well. But anyway, before anything else, my name is Mr. Alan Matus, and I am a nurse educator. I have been teaching students for almost 25 years. I've been teaching NCLEX ever since, and at this time, I'm also a nursing faculty of a nursing program in Los Angeles, so I teach vocational nursing students. I have been an instructor in different nursing programs like BSN, RN, and also Masters of Science in Nursing program. Also, I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. And also, I have a book that I have published in Amazon. I'm an author. The title of the book is Simple, Fast, and Easy NCLEX Review. And so far, you can buy that from Amazon or Barnes & Noble as well. Okay, so we have students here who actually have bought the book. Well, again, everybody, thank you very much for being here. And it's already almost at the end of the year, okay? But before anything else, I would like to ask everyone if you can please share this Facebook Live with your friends or your classmates. And also, if you're watching in YouTube, you can also click subscribe so that you don't miss any sessions that we have. Okay. Also, since we started late tonight, we're going to go ahead with our agenda, of course. Okay, but before that, I would like to welcome some people here tonight. So actually, we have my current students here. Carlos is here. Also, we have other people here. We have Gerthy Silvestre. Okay, if you can let me know also which country or state you're coming from. I would like to find out if you are an international student or you are within the United States as well. Okay. Now, also, Priya Paul is first time. I'm on live from New York. So thank you very much for being here tonight. Also, I hope that you will learn something. And don't forget that you can watch some of our sessions in YouTube as well. So just visit the channel Matus Nursing Review in YouTube and you have all of this. Okay. Also, we have... So Atet is also here again. So Atet is a regular for our Facebook Live every Thursday. So, okay. And just to let you know, everybody, since we started this Facebook Live in March or April, I guess, we never missed a session. Every week, we have been doing this Facebook Live. So I really make sure that every Thursday I do this Facebook Live because number one, I am so excited and passionate about this Facebook Live. And number two, I get to meet my students as well and answer their questions. And also we have Revelo also from the Philippines. Thank you for being here again also tonight. Also, Claire is also here. Claire is a longtime student as well. She's our student in the Online NCLEX Academy. So thank you, Claire. Miriam, okay. You're not late, Miriam. We actually started late. Okay, so Los Angeles. Okay, so we also have Kenny. Hi, Kenny. You're from Texas, and Kenny is actually our student in the Online Academy as well. Okay. All right, so I think I have prepared exciting questions for you tonight, and the secret is this, okay? It's really different if you listen to someone from someone who is explaining to you the rationale for the answers to the questions. But again, I would encourage you to watch our sessions in YouTube, okay? And also all of these sessions that we have are organized and also in our Online NCLEX Academy. So if you enroll in our program, all of these videos are organized and arranged in such a way that you can watch them from, I think, April up to the current date. Okay. We have Hi Faye. Faye is our student in the 10-day NCLEX review program also, and she's here. And she is from Virginia Beach. Okay. And then also Chica Anya is from Texas. So before anything else, also I would like to show you our motivational photo of the week. Okay, so we have the motivational photo of the week. So this is actually, or these are actually the envelopes that we sent out to several students for our live review webinar. So, so these are the workbooks and the bookmarks that I usually send out to students, and some motivational post-its as well. So I'm really very happy that we've been sending out workbooks to students, and hopefully it's been helping them a lot in their NCLEX review. Okay, and of course, we have our testimonial for last week. We have Audrey. So Audrey already passed his NCLEX, and he did a recommendation, and hopefully this will motivate you also, guys, and inspire you in your NCLEX review. So Audrey says, I have been following Sir Matus FB Live discussions about nursing prioritization and delegation, and it made answering these types of questions less harder in the NCLEX. So furthermore, I also gained more confidence in taking the NCLEX, made me feel that I can make it, and I was right. I successfully passed it last September 4, 2020. So to all nurses who's going to take the NCLEX, I strongly recommend Matus Nursing Review. You'll never go wrong with it. So again, we have one life has been changed again, and I'm really very happy about that because of the impact that I make. And there's nothing more fulfilling than knowing that someone passed the NCLEX and then you are part of their effort in passing the NCLEX, and that's really changing lives, and I think that's really making a big difference in the lives of our students. So thank you very much, Audrey, and congratulations again. Okay, so a big announcement for everyone. Okay, so this is November, and again, okay, just to make an announcement, everybody, we have Black Friday that is coming this month. So we're gonna have, I think, starting November 24, I guess, we're gonna have a sale of our online courses. So we're gonna have 50% probably for some of the courses. So wait for that, everyone. Wait for the announcement. And also the good news as well is that we're going to have discount of our workbook. Okay, so we're gonna make announcement. Our workbook is normally $94 and 50 cents. So we're gonna have a Black Friday sale for that. So we're gonna have some discounts when you buy the workbook. Okay, all right. So wait for our announcements for the big sale, and it's gonna be from November 24, I guess, to November 28. So within those time frames, everyone, wait for the announcement. Okay, and make sure that you grab the opportunity because we normally don't have really a lot of sale. Okay. Okay, and again for tonight, we have a giveaway. So our giveaway for tonight again is a free 90-day online access NCLEX review. So everybody who joins tonight, you will be placed in a website, and then whichever name appears first will be the winner. And I usually take a screenshot of the winner, and I post that in the comment section also. So that's how. So all the attendees in the program are being placed in that website. Okay. All right. And then we get the whoever which name appears first, then the winner. Okay. All right. So everybody, I hope that you are all ready to to have our first question for tonight for prioritization. So for tonight, I would like you to use your critical thinking on how to answer questions that related to arterial blood gas. Okay, so are you all good in ABG reading, everyone, or acid-base balance? So let's see. So at this time, I would like you to imagine that you're sitting down for your NCLEX, and you are trying to answer these questions, because most of the questions that I have prepared tonight are analysis or application questions. So let's see. Okay, so let's have the first question, everybody. So say a big yes in the comment section so that we can post the question. So let's go, everyone. I'm so excited with the questions that we have for tonight. Okay, all right. So number one, prioritization question about arterial blood gas, everyone. Okay, so number one, a client with bleeding peptic ulcer has the following arterial blood gas results: pH of 7.33, bicarbonate of 28, milliequivalents per liter, and carbon dioxide of 59. millimeters of mercury. Based on these results, what is the priority nursing action? A, perform paper bag breathing. B, discontinue the gastric suctioning. C, administer sodium bicarbonate. Or D, provide supplemental oxygen. Okay, again, let's repeat the question. A client with bleeding peptic ulcer has the following arterial blood gas results. Okay, pH of 7.33, bicarbonate of 28, and PCO2 of 59 millimeters of mercury. Based on these results, what is the priority nursing action? A, perform paper bag breathing. B, discontinue gastric suctioning. C, administer sodium bicarbonate. Or D, provide supplemental oxygen. And I would like you to put your rationale for the answer that you have chosen. Why is it that you answered A or you answered letter B, for example, letter C or letter D? So the way you approach this question, everyone, is that you have to interpret the or analyze the ABG values in this question. Okay, find out what is going on with your patient. Is your patient having respiratory alkalosis? Is your patient having respiratory acidosis? Is your patient having metabolic acidosis or metabolic alkalosis? So find out, and then what is your intervention, because those are the things that you need to know in the NCLEX. In the NCLEX, you will not just be interpreting ABG. In the NCLEX, you also have to show how you will be providing interventions based on the result of the ABG of your patient. Okay, so let's see this patient. What is the reading, everyone? So the approach here in the NCLEX is that you have to slow down and really interpret each value. What is the pH, what is the bicarb, and then the PCO2. So when I teach ABG with my students, I always tell them that you really need to know your ABG, your values, and then what does it mean if they're high, if they're low also, what's really happening. Okay, and then you decide what to do in that situation. So in this situation, everybody, the answer is going to be letter. Okay, the answer is going to be letter D, everyone. Okay, D is the answer to this question. And why is D the answer, everybody? Because your 7.33 is acidosis. So remember that your pH is low. Your bicarb is 28, which is alkalosis, and then your carbon dioxide is 59, which is acidosis. In this situation, the reading is going to be respiratory acidosis, okay, because your pH matches your carbon dioxide, which is also acidotic. All right, so if you need more information on how to read your ABG or to master this, I have YouTube videos about ABG reading. So knowing that this is respiratory acidosis, you know that respiratory acidosis is caused by high levels of carbon dioxide because of an imbalance with oxygen. So what happens here, your patient is having low levels of oxygen, and usually the reason, of course, is respiratory difficulty. Am I right? Respiratory difficulty, or the patient doesn't have a patent airway. So oxygenation is a problem, and that's why the answer is going to be letter D. Provide supplemental what? Provide supplemental oxygen. So the answer, everyone, is going to be letter D. Letter A is being performed for patients with respiratory alkalosis when you wish to return the carbon dioxide into the body of your patient because the patient is losing too much carbon dioxide. Am I right? So A is for respiratory alkalosis. Now letter C, that's an intervention for metabolic acidosis. We give sodium bicarbonate. Okay, so remember that. And then your letter B is an intervention for someone with metabolic alkalosis, okay, when you discontinue the gastric suctioning. So you need to know the intervention for each specific type of acid-base balance. So for those who got letter D, congratulations, okay? So Emma said that this is related to hypoventilation, okay? So very good. So really master your respiratory acidosis and alkalosis, okay? All right, everyone. So congratulations for those who got the correct answer, letter D. So we have Alan Torres got letter D, Loretta got letter D, Sujata. Who else? We have Okay, so we have a lot of people who got the right answer in this question, okay, knowing that it's respiratory acidosis. So good job, everybody, okay? All right, are you ready for the next question, everyone? Another ABG question. Are you going to have ABG question in the NCLEX? Of course. ABG is one of those favorite questions or concepts usually tackled in the NCLEX, okay? So don't be afraid of ABG. So let's now have the second question, everyone. Okay, a pregnant client performs breathing techniques during labor. Which of the following signs and symptoms require immediate attention as they may indicate the presence of respiratory alkalosis? Select all that apply. Okay, a pregnant client performs breathing techniques during labor. Which of the following signs and symptoms require immediate attention as they may indicate the presence of respiratory alkalosis? Select all that apply. Okay, so we have the following: A, dizziness; B, lightheadedness; C, salivation; D, tingling in the arms; or E, numbness in the hands. Okay, all right, so let's proceed again. So which ones here will be the signs of respiratory alkalosis? A, dizziness; B, lightheadedness; C, salivation; D, tingling in the arms; or E, numbness in the hands. So this is a select all that apply question, everyone. Okay, all right, so what's your answer, everybody? Do you know the signs and symptoms of respiratory alkalosis? You should know the signs and symptoms of respiratory alkalosis, and we all know that respiratory alkalosis happens because the person is losing a lot of carbon dioxide. The normal carbon dioxide level is 35 to 45 millimeters of mercury. So if you are having respiratory alkalosis, you're losing a lot of carbon dioxide. But the question is, how will you know that your client or patient is having respiratory alkalosis? Okay, all right, so let's see your answers, everyone. Okay, what complaints can you hear from the patient, or what do you think will be the complaint of your patient if he or she is having respiratory alkalosis? Okay, all right, so the answer will be, okay, so some of you are still giving your answers, everybody. Okay, so again, I told you, you need to make sure that you know the signs and symptoms. I think most of you know the symptoms of respiratory acidosis because it is the retention of carbon dioxide. However, your respiratory alkalosis is when you're losing a lot of carbon dioxide. So what are the symptoms when you're losing a lot of carbon dioxide? Okay, so the answer to this question, everyone, is going to be, okay, so the answer will be A, B, D, and E. Very good. I think Freda Villanueva got the right answer. Congratulations. Okay, Alan Hill Torres also got the right answer for this question. Very good. Because in respiratory alkalosis, you're going to have dizziness, you're going to have lightheadedness, you're going to have tingling in the arms, and also numbness in the hands. You don't have salivation. In respiratory alkalosis, you actually have dry mouth. Dry mouth, not salivation, everyone, but dry mouth, everybody. So congratulations for those who got the right answer, everyone. Very good. Okay, so don't forget the signs of your respiratory alkalosis. And the question now is, what is your intervention for those with respiratory alkalosis? Okay, that would be paper bag breathing, or you can instruct the patient to slow down with the respiration, okay? Because rapid respiration can lead to the loss of more carbon dioxide, everyone, okay? So just be aware of that, everybody. So you have headache, paresthesia, okay, and then also confusion, maybe. Confusion if it's really severe respiratory alkalosis, even to the point of chest pain, okay? All right, so let's proceed now to the next question, everyone. Are you ready for our next question? Okay, so the next question is a clinical skill. Okay, clinical skill question, and usually you have that in the NCLEX as well. So in our Facebook Live now, I kind of like put some clinical skills now or procedures so that you will be able to refresh your content about clinical skills, everyone. Okay, so your clinical skills now. Okay, this question number 3 is going to be about, okay, the Allen's test or Allen test sometimes. Okay, so the question is, arrange the following steps in performing Allen's test before an arterial blood gas procedure. So remember that Allen's test is a test that we perform before arterial blood gas procedure, before we puncture the radial artery and we draw blood as your specimen. So arrange the following. Is it number 1, extend the fingers, palms up, which should show a blanched hand. 2, release pressure on the ulnar artery and observe for blushing. 3, clench the fist several times. And number 4, occlude the radial and the ulnar artery at the wrist. Okay. What's the answer, everyone? What is the correct sequence for your arterial blood gas here? So arrange the following steps in performing Allen's test before an arterial blood gas procedure. So what do you think is your answer, everybody? Okay. What's the answer to this question? Okay, so first deep breathing. Okay, so some of you answer 3, 4, 2, 1. Some are saying 1, 4, 3, 2. Okay, what do you think is the answer, everybody? 4, 3, 1, 2. Okay, all right. This is going back to your content, everyone. All right, some of you answered 3, 4, 2, 1. Okay. All right. 3, 4, 1, 2 for some of you. Okay. So some people are still giving their answers. Okay. What is your Allen's test, everybody? Okay. 1, 4, 3, 2. Okay. So this is more of a content review, everyone. So meaning that before you take your NCLEX, you want to make sure that you know the steps in your Allen's test. Okay. So let's try to find out the answer, everyone. Okay. So it's very interesting because some of you have, a lot of you have different answers in this question, everybody. So let's try to find out what's the answer to the question. Okay. Okay. So the answer to the question, everyone, is going to be, are you ready, everyone? So the answer is going to be 3, 4, 1, and 2. So 3, 4, 1, and 2. So meaning that you occlude the radial, you clench the fist several times, and then you occlude the radial and the ulnar artery at the wrist. Next, you extend, next is you extend the fingers, palms up, you should show a blanched hand. And lastly, you release the pressure on the ulnar artery and observe for blushing. So that's the correct answer, everyone. Just to further explain or discuss this question, everybody, 3, 4, 1, 2. Okay. Just to explain this more. Number 1, when you do your Allen's test, the purpose of that is to determine the patency of the ulnar artery. Okay, the patency of the ulnar artery. If you're going to be asked, what is the site or what is the artery that we puncture in ABG? That would be the radial artery. And the radial artery is right here, along the thumb. That's the radial artery. However, a possible complication of arterial blood gas specimen withdrawal is damage to the radial artery. So we do the Allen's test to make sure that if in case the radial artery is damaged, the ulnar artery is patent to take over the circulation. Am I right? So we check the patency of the ulnar artery so that we can puncture the radial artery. Am I right? So the first thing that we have to do is to clench your fist. Okay. And then after clenching the fist several times, okay, occlude the radial and the ulnar artery. And you can see that I'm occluding the radial, which is along the thumb, for example, and then the ulnar artery along the little finger. Okay, so we do that. We occlude both, and then we extend our fingers. Okay, so let's see if it's gonna work. So we extend our fingers, and you can see that my hands are blanched. Okay, so meaning that it's whitish. And then after that, you release the ulnar. Okay, if it turns pinkish or blushing happens, then meaning that your ulnar artery is patent. So meaning that it is safe to puncture the radial. So again, if you're going to be asking the NCLEX, okay, the Allen's test, okay, what is the test for? That is a test for to check the patency of the ulnar artery so that we can puncture the radial artery, everyone. The question also is, can the RN perform Allen's test? Yes. Okay, but can the RN withdraw from the arterial, the radial artery? Usually in some books they even mention that respiratory therapists are the ones that withdraw the blood specimen for ABG. Okay, all right, so again, just to review everybody, okay, so these are the steps for your Allen's test. Clench the fist several times. Number 2 is to occlude the radial and ulnar artery at the wrist. 3, extend the fingers, palms up. We should show a blanched hand. So it will be blanched once you extend your fingers. So you occlude the radial and the ulnar, right? So number 4, release pressure on the ulnar artery and observe for blushing. If the color of the hand does not return in 5 to 10 seconds, then the Allen's test is considered positive, and puncture to the radial artery should not be attempted at that site. Okay, so again, just remember the explanation here. If you're going to be asking the NCLEX, do we occlude the radial and the ulnar artery? The answer is yes. We occlude both of them. Okay, we press them, we occlude them. Okay, and then which artery do we release the pressure? The artery that we release the pressure is the ulnar artery, because we want to find out if the ulnar artery is patent. And then after that, observe for the return, the blushing. It has to return in like 5 to 10 seconds. Some books would mention 15 seconds, but 5 to 10 seconds. And if the color does not become pinkish or the color of the hand does not come back to normal color, then it's positive. You have a problem. So you cannot puncture the radial artery, everyone. So just remember your Allen's test, everyone. Another one mentioned also, Gertie mentioned that you have to carry on ice to the lab. Exactly. That's another one. One thing to remember. And also after Allen's test, you really have to put pressure. Put pressure for at least 5 minutes, okay, minimum, in order to prevent bleeding. Remember, we are puncturing the radial artery, and that is an important artery. So we want to make sure that we put pressure to prevent bleeding after the withdrawal of the specimen. Okay, all right. Can LPNs perform withdrawal of specimen from the artery? I don't really think so, because that is a complex procedure. So we have to give that to a more probably to the registered nurse or to the respiratory therapist. Okay, all right. Okay, so that's it, everyone, for a little bit of ABG. Now, are you ready for our delegation question, everyone? Okay, are you ready for our delegation question, everybody? And always remember that when you have ABG, you always have to look at your policy and procedure. Okay, in the facility where I worked before, subacute facility, the ones who withdraw the blood specimen for ABG are the respiratory therapists. Okay, and recently as well, be aware of this. In some states, LPNs cannot touch anything about the ventilators or even registered nurses. So you have to check your policy and your State Nursing Practice Act, okay? Because ventilator settings, especially, or management for that, could be for the respiratory therapist, okay? All right, so let's proceed now to your delegation, everyone. If you're ready, let's have the number 4 question, everybody. Okay, so number 4, this is your delegation question, everyone. So let's see if you're ready to ace the questions in delegation. And a lot of students who attended our Facebook Live really always go back to me and say, Sir Alan, there's a lot of delegation questions in my NCLEX, and I passed the NCLEX. And that is really very good, everyone. Okay, all right, so let's have your delegation question. So the registered nurse, this is the usual question that you will see in the NCLEX. The RN working together with the UAP and the LPN. So the registered nurse assigns tasks to the unlicensed assisted personnel and licensed practical nurse while caring for a client with advanced emphysema. Which of the following tasks can be delegated to the UAP? Select all that apply. A. Administer metered dose inhaler steroids. B. Place the client in upright position. C. Adjust oxygen administration. D. Check the temperature every 4 hours. E. Remind the client to drink water. Or F. Monitor the color and the amount of sputum production. Okay? Again, the registered nurse assigns tasks to the unlicensed assisted personnel and licensed practical nurse while caring for a client with advanced emphysema. Which of the following tasks can be delegated to the UAP? Select all that apply. A. Administer metered dose inhaler steroids. B. Place the client in upright position. C. Adjust the oxygen administration. D. Check the temperature every 4 hours. E. Remind the client to drink water. Or F. Monitor the color and the amount of sputum production. Okay. So all over the past few weeks, okay, we have been giving you a lot of delegation questions. Some of you did not get the right answers. Some of you got the right answers. But for tonight, I have a very good feeling that you will be getting the right answer. And hopefully in the NCLEX, this is the kind of question that you will have. Okay. And what did we say the last time? Always remember that for the UAP, they are responsible for activities of daily living, simple tasks only, not complex tasks. Anything that is complex, anything that probably includes sterility, especially procedures that require safety and infection control, you cannot provide that to the UAP. Anything that is invasive. Okay, so it's more of critical thinking. You really have to think, if it's something that the UAP can do. Okay, but as what we said the last time, UAPs can do your bathing, your ambulation, your exercises. We have discussed all of those things. So remember the 3-letter S's. The 3-letter S's. You know what are the 3-letter S's, everyone? Okay, that would be, it has to be a simple task, it has to be a stable patient, and lastly, it has to be within the scope of practice of the UAP. Okay. Sometimes I get the question, in California, we have certified nursing assistants. Are they also UAP? Of course. So CNA fall under the category of UAP, everyone. Okay? But in other states, you also have different categories of UAP. All right. So the answer for this question, everyone, I think most of you, let's see. All right. The answer is going to be letter, okay, B, letter D, and letter E. Congratulations. I think most of you got the right answer. We need to celebrate everyone. Okay? All right. So we have that. So George said that there needs to be a specific time frame. Okay. Hi, George. How are you? George is my student. We also have Shrestha Sujata, yes sir, thank you for the effective class. Thank you very much. And I hope you're learning, okay, everyone, because I know that this is one of the weak spots of students sometimes in the NCLEX. So congratulations, guys. Your administration of the nebulizer, or the, let's say the metered dose inhaler rather, that would be for the LPNs. LPNs can adjust the oxygen administration, monitoring the color and the amount of sputum production. That should be for the licensed nurse. Okay? All right, so that's correct. B, D, and E. Congratulations. Okay, we're not done yet, everyone. Faye, we're not done yet. We have one more question, Faye. All right? So, another delegation question. Right. Okay. Party at Carlo Canya's house. Okay, so that's good. All right. All right, so let's proceed. Now, let's have the next question, everyone. Are you ready for our last question? Okay, so that would be another delegation question. So this one is a typical question in the NCLEX in terms of delegation to the LPN. Okay, So in this situation now, it's not just a question about what can the LPN do, but the situation now is you really have to look at the clinical condition of your patient. Okay, so clinical condition, because we all know that LPNs are only supposed to receive or have delegation of patients only that are stable patients. Okay, so let's proceed, everybody. Okay, so we will have number 5. Okay, so we're gonna have your delegation question. Okay, all right, so let me read. Okay, so which of the following clients may be assigned to the licensed practical nurse while under the supervision of the registered nurse? Okay, all right. So a 34-year-old client with peptic ulcer who is scheduled for gastric resection surgery. B, a 25-year-old client who has an order for bolus tube feeding due to recent weight loss. C, a 45-year-old client who came in after a bronchoscopy to rule out lung cancer. Or D, a 56-year-old client who will be discharged with oral anticoagulants to be taken at home. Okay, again, which of the following clients may be assigned to the licensed practical nurse while under the supervision of the registered nurse? So this question both applies to the RN or the LPN. So you should know which kinds of patients are you supposed to receive. A 34-year-old client with peptic ulcer who is scheduled for gastric resection surgery. Letter B, a 25-year-old client who has an order for bolus tube feeding due to recent weight loss. Letter C, a 45-year-old client who came in after bronchoscopy to rule out lung cancer. Or D, a 56-year-old client who will be discharged with oral anticoagulants to be taken at home. So what's the answer, everybody? Okay, so here you have to find the most stable patients that you can delegate to the LPN. And again, I would like you to write your rationale. Why is it letter B? Why is it not A, C, or D? Why do you have any other answers? So let's try to find out your rationale for this question, everyone. Okay, all right, ACD is RN rule. Okay, so just remember, everyone, that we discussed the last time that RNs are not supposed to delegate it. RN cannot delegate anything with ongoing evaluation or monitoring. RNs cannot delegate patients who are unstable, who needs assessment, and also those who need teaching. So don't forget your EAT, okay? EAT. So the answer for this question, everyone, is going to be letter. Who do you think? Okay, the answer is going to be letter B. Very good, everyone. You're doing a great job. So the answer is letter B, a client who has an order for bolus tube feeding due to recent weight loss. So basically, there's no indication that this client is unstable. The only thing is that you have to give bolus tube feeding to this patient for nutrition. And that's within the scope of practice of the LPN to provide bolus tube feeding. Okay, your letter A, a patient is scheduled for gastric surgery. Okay, this patient scheduled for gastric resection surgery, the preparation needs to be the RN. Okay, RN needs to prepare that patient. Letter C, a patient who just came in after bronchoscopy. So that would be an unstable patient compared to letter B because who just came in. Okay, so that's a recent patient. So that could be unstable just coming out of a procedure. And then letter D, that would be a 56-year-old client who will be discharged with oral anticoagulants to be taken at home. So always remember that discharge stitching should be the responsibility of the RN, everyone. So congratulations, guys. And then also my said PACE or PACET, you know, that's her PACET or PACET. That's her acronym to memorize the scope of practice or the task that should not be delegated to the LPN, everyone. So I would like to find out how many points did you get tonight from 5 out of 5. Okay, hopefully everybody, and I hope that you learned something tonight. Your number 5 question is a common situation in the NCLEX, and how will you find out that this is a stable patient for the LPN? just remember the time frame. The time frame, if it's a recent patient, that could be an unstable patient. Always look at the condition of your patient. If it's a patient with myocardial infarction recently, with premature ventricular contractions, so that could be an unstable patient. A new patient with stroke, so just be aware that it's an LPN. You should receive only stable patients, everyone. Okay? All right. And always remember that the task that you're going to do is going to be within your scope of practice. Okay? So we are now going to announce the winner of our what? Of our 90 days. So let's see who won. And then I would like you to send me an email immediately if you are the winner for tonight. But again, just to let you know, guys, our program in the Matus Nursing Review Online NCLEX Academy, we have a self-study program, we have the 10-day live webinar, and we also have the 12-week fast track. So we have classes for Saturday and we have classes for Tuesday. Those are live webinars. So I'm going to post the link in the comment section, and feel free to check the programs. Okay, so we have the 10-day webinar and then the 12-week fast track, and all of them comes with a workbook. So our fantastic workbook that everybody likes. Okay, what do you think? Those students who have my workbook, what do you think of the workbook, everyone? Okay, and there's a book version for that as well. Okay, so just remember, at this time, this is our pricing. Our workbook is $94.50. However, we're gonna have a sale coming this November, and then also if you want to have a subscription per month, that would be $49 per month to access the online academy, so you can use the workbook while you are watching all the videos. And tons of students really love the workbook, everyone. Okay, so thank you again, Coach Allen, for another interesting and learning night, of course. All right, so everyone, are you ready for our winner for tonight? Our winner is, for the giveaway, is Beatrice Cantania. Okay, very good. So Beatrice, you're our winner. Okay, for the 90-day online NCLEX Academy. And that, I think, is almost more than $100. Okay. So please, everyone, congratulate Beatrice Cantania. I'm going to post also in the comment section the photo of how we got Beatrice to win this program, everybody. Okay, so congratulations again, guys. Thank you very much, Kenny. Okay, our usual students in the class tonight, thank you very much, and hopefully next time, okay, next time, hopefully we don't have any more problems, okay, in terms of technical issues. And again, just to remember, everybody, that our goal here, okay, is to make a difference in the students' future. I'm here to always make sure that our program is improved, making sure that it's simple, fast, and easy. Okay, and we do have success stories, and you can always see that in the Facebook testimonials. Again, everyone, follow me also in YouTube, Matus Nursing Review channel, and then also very, very important, wait for our or watch out for our Black Friday sale this month, everyone. Thank you very much, everybody, and have a good night, everyone. See you again next week.